This video demonstrates the patient pathway and practice setup for urgent dental care within Yorkshire and Humber during the COVID-19 outbreak. It provides examples of good practice based upon current guidance. However, providers of urgent dental care need to keep up to date with guidance, in particular from Public Health England and NHS England. Prior to a patient arriving at your surgery, they should be called and further triaged regarding COVID-19 symptoms and the need for urgent dental care. Where patients are able to consent for themselves, they should attend on their own. Any exemptions need to be confirmed, and where payment is required, ideally this should be arranged over the phone. Patients should also be given relevant instructions with regards to their attendance, including waiting in the car on arrival. Once the patient has arrived, they should call the practice and remain in the car until the practice are ready for their attendance. At this point, the escorting dental nurse will don the appropriate PPE if they cannot maintain a safe 2-metre distance from the patient at all times. Following a phone call from the practice, the patient will attend on their own, ensuring that they do not bring any unnecessary items such as bags or coats. Your practice will need to make sure that there are single entry and exit points to allow for one-way flow of patients where possible. The escorting dental nurse should open the door, ensuring that the patient does not touch any surfaces where possible, and social distancing measures should be applied, including markings on the floor to indicate where the patient should stand, and also areas not to be touched or crossed. The patient should be given an alcohol hand rub to be used once they have walked into the practice. Thereafter, a non-contact thermometer should be used to assess the patient's temperature in cold sites. However, if this is not available, an alternative thermometer could be used, ensuring that they are cleaned appropriately. If the patient is unable to pay by card in advance, then any cash should be brought in a wipeable bag and cleaned once received. It is important to zone your practice so that patient travel is minimised. In order to prepare the surgery, all unnecessary items should be removed, and only the essential equipment and materials required for that specific treatment episode should be set out. A trolley should be set up outside the surgery should any additional equipment be required mid-treatment. Ideally, there needs to be a minimum of 2 active dental surgeries and separate donning and doffing stations. This 4-surgery practice has the 2 end surgeries set up for treatment and the 2 middle surgeries set up as separate donning and doffing stations. Where this is not possible, a clean surgery can be utilised for donning the PPE prior to the patient's arrival. If a doffing station is not available, then gloves and aprons or gowns can be removed within the surgery following completion of treatment, but eye protection and masks or respirators should be removed outside the surgery into a clinical waste bin. Once the surgery is prepared for treatment, the treating dentist and assisting nurse should be donning the appropriate PPE. Please refer to the Public Health England guidance and videos for donning. Once they're ready, the patient will be guided into the surgery, and then the door should remain closed where possible during treatment. Windows should be left open to allow for ventilation into the surgery. Where further equipment is required, the runner nurse can pass this through the surgery door but should not enter the surgery at any point. After the patient is guided into the surgery, the escorting nurse can then clean any surfaces that may have been touched by the patient. Once treatment is complete, the escorting nurse can guide the patient out of the practice via the designated exit. The time of exit should be annotated and displayed on the door where possible. At this point, the dentist and assisting nurse can remove their PPE in the doffing station. Please refer to the Public Health England guidance and videos for doffing. In most dental surgeries, it will be safe to enter the surgery after 1 hour following the completion of treatment. The surgery should then be cleaned in the appropriate PPE using a chlorine-based disinfectant at the appropriate strength. Please see the Public Health England guidance on infection control and PPE.